name is Konrad Filutowski, and I'm an ophthalmologist in Florida, in Orlando area. And my specialty is cataract surgery and refractive surgery. So recently, I had an interesting experience with one of our LASIK patients. And I'm going to tell you a little bit about this patient. This patient is about 32 years old, 33 years old. This patient had LASIK with us, and at his 1 month postoperative visit, his uncorrected visual acuity was 20/15. He was doing fantastically. Unfortunately, 4 months after his LASIK, he had a vehicle accident where the airbag went off in front of him, and there was trauma to his face. So he had multiple small cuts on his face, and there was trauma to his left eye. He ended up in the emergency room, and he got stitched up. And the emergency room doctor diagnosed him with corneal abrasion, prescribed antibiotic eye drops, and 1 week later, the patient stopped by our office complaining of blurry vision in that eye, in his left eye. So we took a good look at his left eye, and indeed his vision was blurry. His vision at that point was about 20/30, surprisingly so. But when we examined him carefully, we noticed that his flap was missing. So the bed under the flap has re-epithelialized. The epithelium was somewhat rough, and there was no flap. And when I looked underneath his eyelid, I noticed that his flap was still there, attached by the hinge of the flap, and it was plastered against his conjunctiva. So I took him to the operating room and cleaned his corneal bed, cleaned all the epithelium away, and cleaned his flap. Interestingly, the flap underneath had no epithelium that has grown on the underside of the flap. I still don't know how the epithelium knew not to grow there, because it perfectly re-epithelialized his bed, but not underneath his flap. So clean the underneath of the flap as well from whatever debris there was, and reposition the flap, smoothed it out as best as I could, put a contact lens over the eye, and we allowed him to heal. Within a couple of days, we took the contact lens off, and 2 months after the injury, his best corrected visual acuity was decreased from 20/15 down to 20/25. And he had a refraction of -3/4 +150 that still did not correct him to 20/20. He has a little bit of epithelial ingrowth under the flap at the edge. The interface has some moderate haze. So we thought that with time, we will let him heal a little bit more, and that he simply will need a PRK enhancement. We did have a chance to see him for his 5-month post-injury visit, and he has recovered some more. His prescription now is Plano. His vision is still not 20/15, it's 20/20 blurry, but looks like he has improved a little bit more. So it's an interesting case in a sense that when we sometimes talk about the advantages and disadvantages of SMILE versus the LASIK, one of the things we talk about is that with SMILE, there is no flap that can get displaced. And even though the chance of such displacement is very small, it does exist. So this case is a perfect example of a situation where there was a displacement of the flap. It happens rarely. I have seen other cases where a sharp object went across a patient's eye and caught the edge of the flap, and the flap got lifted and partially lifted or fully lifted and displaced. These are rare situations. And obviously with SMILE, if this patient had the SMILE procedure and had an airbag injury, there would be no displacement of the flap because there is no flap with SMILE. So it's an excellent example to show where SMILE has a significant advantage over LASIK. Now, I've heard many comments about patients in military, our soldiers, having refractive surgery, and surprisingly, PRK has been the preferred procedure over LASIK. LASIK has much quicker recovery. It's a much easier procedure to go through. And one of the reasons why PRK has been preferred, according to Dr. Steve Schallhorn, is that the soldiers have a potential of being in a place where there can be harm done to their eye. And there's always a concern about the stability of the flap. So PRK, there is no flap. Nothing can happen if there's an injury that goes across the eye like this. But now with SMILE, it's a similar situation. There is no concern about that. And from what I understand, SMILE is being performed by the military, and it is becoming popular with the military, in part because it has such a quick visual recovery, just like LASIK, but also has the stability that there is no flap, that the flap cannot get displaced. One other thing to add about this patient is that for one of the postoperative visits, he came in a military uniform. So I always heard these comments that, okay, you should have PRK versus LASIK if you're in military, and because of the injury that can happen to your eye. And he shows up one of his post-op visits after the injury in a military uniform. And surprisingly, he is in Army National Guard, and that's why he was in that uniform. So it just kind of all goes together. This whole case, this whole story goes together, that if he had PRK or if he had SMILE, this injury would not have happened.